the press, let me thank you for your patience and for your understanding. We are in difficult times, and the task force has a lot of other contending engagements that we have to attend to in order to be ahead of the curve in our pursuit for an aggressive and sustainable strategy as our response to COVID-19 in Nigeria. Particularly members of the press, I want to appreciate you and thank you for your resilience and tolerance generally over the course of the last couple of days that we've conducted this media briefing. I welcome you to the national briefing for Friday, 10th April 2020. Today is the 12th day of the lockdown of Lagos, Ogun states, as well as the Federal Capital Territory. As reported to you earlier in the week, our evaluation of the impact of the restriction order continues. The Presidential Task Force, a small committee of us, this afternoon had the privilege of further briefing Mr. President on the assessment of our response to COVID-19. And at the appropriate moment, we will continue to adequately inform Nigerians of government decisions. In recognition of our shared responsibility as citizens, the Presidential Task Force on COVID-19 renews its appeal to Nigerians to continue to comply fully and willingly with all the advisories and orders given in this regard. We underscore the deadliness of the coronavirus with all seriousness. Yesterday, for about 5 hours, the PTF briefed the leadership of the National Assembly as part of our continuing collaboration between the executive and the legislature. Earlier in the week, the leadership of the National Assembly met with the committee, the Economic Committee on the Impact of COVID-19, ably led by the Honorable Minister of Finance, Budget and National Planning, and also met with the Minister of Humanitarian Affairs, Disaster Management, and Social Development with her team. The discussion we had with them yesterday was rich, factual, and robust in our national interests. The COVID-19 pandemic has provided both arms of government the unique opportunity to significantly assess and agree to reform our public health system in the short, medium, and long terms. I wish to thank the National Assembly under the leadership of the President of the Senate and the Speaker of the House of Representatives for their invaluable guidance and commitment to deploy all legislative resources and powers to support the fight against COVID-19 virus. On the issue of face masks, the Presidential Task Force is developing a national policy on its usage, and Nigerians will be duly informed as soon as the policy is finalized. Let me use this opportunity to commend and thank our frontline health workers for their commitment and sacrifices. The nation appreciates you and shall do everything possible to protect you. The government is concluding on the issue of your incentives, medical and life insurance, as you battle to save lives. Yesterday in the National Assembly, I mentioned at the National Assembly that I became fully aware of the state of our medical system during the execution of this task force assignment. It has become clear that this has been taken out of context. I must clarify that I am aware and has indeed been a champion for the reform and transformation of the healthcare system. And in my modest way, even in my community, I'm working assiduously to see to the improvement of the healthcare system in my small community. However, this PTF assignment has afforded me the opportunity, and I believe all members of this committee, to dig deeper, interrogate, and x-ray the system better. If I had asked the Permanent Secretary General Service Office to make available to you since yesterday the copy of my 7-page address to the National Assembly, where I spoke about what this current opportunity of the pandemic gives to us. In paragraph 9, I said the pandemic has provided the unique opportunity to x-ray the state of the national health care system, which is in dire need of reforms and funding. The weaknesses in our health systems became more glaring given the way more established health systems in Europe and America collapsed under pressure. The plan, therefore, I'm quoting from my speech yesterday, the plan, therefore, is to lay a legacy foundation for the immediate, medium, and long-term development of the health system. I even went further to suggest to the National Assembly in paragraph 12, I said, in addition to providing the kind of leadership already demonstrated by the National Assembly, let the National Assembly find itself in the unique position to do the following, though not exhaustive. I said, 1, develop a legislative framework to prepare Nigeria for any future pandemic. 2, develop a legislative framework for reforming and transforming our healthcare systems. 3, strengthen the legislative framework for economic growth through domestic manufacturing of our medical and pharmaceutical products. Deepen the legislative oversight during this pandemic and beyond. Pass legislation that will further ease the ability of the executive to cushion the impact of the economic decline. And I requested them to be part of the community mobilization and enlightenment efforts. So for anyone to think that I didn't know the level of the deplorable state of our healthcare systems, that's a complete misrepresentation. For the benefit of those of you that don't know me well, I come from rural Nigeria. I was born in a village almost 64 years ago that didn't even have a hospital. It had only a small missionary dispensary, probably with 1 midwife. No birth certificates were offered. So I don't even have a birth certificate. I have a declaration of age. A lot of you sitting here are privileged to have been born in better and more equipped medical facilities. So from birth, I know the state of our medical healthcare system. I'm not a foreigner. I'm fully seized of it. My statement was totally taken out of context because that was not the reflection of what I said. But having to serve on this committee gave me a further insight into what is happening. Most of the things you see around are specialists or hospitals or clinics. You just see the buildings. You don't know what is inside. But having to serve on this committee has given me an opportunity of walking into these facilities and looking at what they have in direct relation to what they ought to have. And my conclusion on that is that they don't have what they ought to have. So I wanted to give this explanation and clarification so that most of you should not think that I'm an Ajabota. No, I was born in rural Nigeria. I grew up in rural Nigeria. I went to school in rural Nigeria. I still live in rural Nigeria. Yola is my home. I'm just sojourning here in Abuja. At the end of my work or whatever I'm doing here, I return back home, which is rural Nigeria. And I'm going to live with the facilities in rural Nigeria. I want to thank you for your understanding. And the truth about it is that there's so much ground to be covered. We shouldn't allow ourselves to be distracted by unnecessary controversies. Before I yield the podium to the Minister of Health and other members, I want to once again appeal to all subnational entities to recognize the serious nature of this situation and to synergize with the federal government so that together we could win the war. We do not have different response. We have one national response. It is expected that each and every subnational government should fit into this national response so that we can collectively deploy our resources, our strategies, and our personnel to directly deal with this unseen and uncommon enemy. I now yield the podium to the Honorable Minister of Health and other members of the PTA for further updates. And I want to thank you very much for listening.
Honorable Ministers, Directors here present, ladies and gentlemen, I want to build on what the Secretary to the Government has so eloquently put forward and put the point of the Ministry of Health forward. First of all, the situation report. As of today, the 10th of April 2020, Nigeria has recorded 288 confirmed COVID-19 cases, of which there are 14 confirmed cases, 13 from Lagos and 1 from Delta. This increase is due to the diligence in tracing and testing, which is ongoing. I believe there is a backlog that is being picked up here. But Lagos remains the epicenter with 158 cases, and FCT has 54 cases. The third is in Osun, 12 in Edo. Osun is 20, 11 in Oyo, 8 in Bauchi, 5 each in Akwa Ibom, Kaduna, 4 in Ogun, 2 in Delta, and 1 each in Benue, Katsina, and Ondo. The Federal Ministry of Health, through the Center for Disease Control, is increasing testing capacity continuously. And as of today, we have about 10 laboratories capable of testing COVID-19. We have 2 in Abuja, the National Reference Laboratory in Gadua, and the Defense Reference Laboratory in Mogadishu, Abuja. We have 3 in Lagos, appropriately because of the cases they have. And they are the laboratory in Luth, the Lagos State Biosafety Level 3 Laboratory, and the Nigeria Institute of Medical Research. We also have testing capacities in Nurua, in Oyo State, in UCH, Oyo State, that's Ibadan, and the Federal Teaching Hospital Abakaliki, and the Africa Center for Excellence in Genomics in Ede. There are other states that are on stream: Kano, Borno, Kaduna, Sokoto. The NCDC supports response activities and preparation in all states through timely deployment of rapid response teams to every outbreak state, and they contribute significantly to improving contact tracing, case management, risk communication, infection prevention, control, and also by providing training, guidelines, and personal protective equipment. Continue to enhance the capacity and understanding of frontline workers for this novel virus. The Federal Ministry of Health's COVID-19 Accreditation Committee is inspecting public and private treatment centers and following strict infectious disease management protocols in order to increase bed capacity for COVID-19 isolation and treatment nationwide and to protect health workers from harm. They will soon start this inspection and accreditation tour to all states, beginning with those with active COVID-19 cases. The bed space expansion starts with our federal tertiary hospitals, who will also be the centers for ICU at the beginning, where separate wings have been reserved and converted for COVID-19 management. Lagos University Teaching Hospital commenced such operation last Monday with a 60-bed isolation center, having received a COVID-19 starter pack and trained healthcare workers. I want to mention here that the Future Assured program of Her Excellency, the First Lady, has assisted us in locating a treatment center which is currently under renovation at the cadastral zone area. We particularly appreciate that. All designated isolation and treatment centers have adequate supplies to manage cases, and there is no shortage of personal protective equipment, and also no fear of shortage in the short term for health workers. It must be noted that there is a limited supply of consumables in the market due to increased global demand and increased production to public health crisis. We are, however, developing in-country manufacturing capacity. Citizens should use limited supply of this equipment judiciously. And also bear in mind that this should not be a time for hoarding or for price gouging or for making profits. Health workers have priority in rationing of commodities because they are more at risk. Private practitioners have a big role in educating the public and protecting patients and frontline health workers, and by having a high index of suspicion to identify, advise, and swiftly refer suspected cases to designated management facilities for testing and according to NCDC guidelines. However, private facilities must apply to the Federal Ministry of Health for accreditation before engaging in treatment of COVID-19 patients. They also share in the responsibility to maintain essential and emergency service at all times and ensure safe transfer of suspected cases of COVID-19 by dialing the toll-free emergency number 112 or the NCDC toll-free number of 0800 97000010. I wish to underscore the importance of giving accurate and complete information on symptoms or your travel history to healthcare workers when you are seeking care, so as not to endanger yourself and also endanger the proper diagnosis or put healthcare professionals at risk. I've said before that some persons are continuously giving wrong information in order to mislead healthcare workers. Only the designated treatment centers can provide safe isolation and management of COVID-19 patients, and also to avoid spreading the virus to your family members and to friends and the public. All medical practitioners and healthcare workers, and also the public, are reminded that COVID-19 is such a highly infectious disease that they should abstain from trying to privately treat it and or manages cases in their homes. They should all, as I say, be referred to healthcare facilities. While the government is encouraged by the commendation from the World Health Organization and the UN, we shall not relax, because we still need to further develop our strategy and sharpen our processes to face the coronavirus challenge, the magnitude of which we cannot yet fully guess. I shall reiterate the importance of everybody observing good respiratory hygiene, hand washing, social distancing, and once again urge Nigerians to obey this stay-at-home order, especially to protect yourself, protect healthcare workers, and follow the guidance of government. Both public and private sector workers must also be reminded to maintain a high index of suspicion and not to treat all cases of cough and catarrh with levity, and to employ infection prevention and control measures and refer all suspected cases to the facilities and visit the website covid19ncdc.gov.ng for updated information, including national case definition guidelines and other advisories. No citizen should be sent away from a private hospital without being given advice. I also want to advise against rumor mongering, which creates needless fear and restiveness in society. All information is provided to the public. Nothing is held in secret. And thank you all very much for listening.
Thank you, Honorable Minister of Health. Director General, NCDC.
So today we'll pick up for a few minutes on a concept that we have described up till now as social distancing. But I would actually like to introduce a new term that probably better defines what we're trying to do, and move from the term social distancing to physical distancing. Because what we're suggesting is not for you to be socially apart from each other. We're suggesting that we stay physically apart, but you use technology and any other means available to you to actually increase your social relationships, because it's by increasing it through other means that we can maintain our mental well-being, our relationships, and as well achieve our goals of keeping the virus apart from us. We have a peculiar challenge in Nigeria. Everybody knows that we have a population of 200 million. But what people don't quite know is that we have one of the highest population densities in the world, and especially in Africa. Just 4 countries have a higher population density than us. 2 of them are island states. Then there's Rwanda and Burundi. After that, we have the highest population density, which means we have the most people living in the same geographical space than most other countries in the continent. This has a different implication for us and the transmission of viruses than just the number. Because if it was just the number, it wouldn't matter that much if we lived apart enough. But we have a very high population density. It is this closeness to each other that really enables the virus transmit from one to the other and makes it easier. So we have an opportunity to try and increase this and maintain this physical distancing. And it is not easy. It's not easy for me. It's not easy for any of the members of this committee. And I can bet it's not easy for any Nigerian, because we are a socially intense people. We live on social interactions. We are known across the world for our music, our dance, our drama. We hold our religious gatherings very dear to our heart. And there's no weekend more important for Christianity than this weekend. There's no weekend that Christians are called upon to come together more than this weekend. So there's no weekend this will be hardest for us, the Christians among the Nigerian population, than this weekend. So I really call on all of us, Nigerians, Christians, Muslims, and whatever other religion that you have, to remember we need to pay a short-term price for a long-term goal. And physical distancing is probably the most important tool So whether we talk about wearing of masks, whether we talk about interruption of mass gatherings, whether we talk about any of the other interventions that we have suggested, we're trying to achieve the same thing, to limit the distance that we have from each other, between ourselves, to about 2 meters. Because from everything we understand about the virus today, it's not the opportunity of transmitting from one individual to the other is made a lot more difficult if we have sufficient distance between us. And we have also learned that from this virus that there are people that carry this virus without presenting symptoms. But critically, the most important thing is that people can be infectious 2 days before the symptoms appear. We call it the pre-symptomatic phase. So while everybody has been talking about the asymptomatics, the most important is the pre-symptomatic. So people that have become infected will become symptomatic, but don't know yet because they're in a few days before that has happened. And that is why we have to increase this distance between us. And like the chair said, even when we announce any decision on masks, the masks are not going to solve the problem. So there have been some messages around the country seeming to imply that wearing a mask makes all the other measures no longer necessary. This is simply not the case. It is simply not, we understand, with the best evidence in front of us. If we do offer an advisory around masks, it will be in addition to everything else. It will not be in place of it. So we have to understand the reasons for these measures. Now, there's something called the Google Mobility Report. It's actually available online to most people. So if you search for the Google Mobility Report, search for Nigeria, it tells you the level of intensity of contact between individuals in different locations in Nigeria. So that report is a little bit delayed, but the last one from the 29th of March showed that mobility trends in leisure centers, supermarkets, transport hubs, and places of employment in Nigeria has reduced by about 27%. That is very good, but it's not enough. We have to push that proportion even further down. So I'm hoping that as data becomes available for the over the next few days, we will see a further reduction because our future really depends on this. Now, we understand and we know that the closures of markets particularly really is hurting many parts of our country. Many people live from day to day and require that trade in markets in order to survive. There's no doubt about this. Nigerians are really suffering from these measures. But in order to restart that economic activity, we need to get over this hurdle. If we pretend that we don't have this hurdle and push to restart economic activity, the obstacle will become even bigger because the infection will grow, transmission will grow, and the outbreak will increase. So, to achieve that, our religious leaders, our state governors, our community leaders really have a role to play. The PTF can only do so much in communicating the importance of this. But the leaders, those that we hold dear, really need to take this message from this stage and from all our other publications and run with it. Translate this to your local languages, interpret this to the lingua you know, let people hear from you. We need the people of Nigeria to hear from their leaders. And the leaders are not only those of us on this side of this room, they're the leaders across the country, from Sokoto to Akwa Ibom, from Kwara to Abuja. We need to hear the voices of our leaders. It is through these community combined efforts that we can emphasize the pain of physical distancing, but also the gain that we will see. And it's in taking this responsibility, not only at the individual level, but at the community leadership level, that we can achieve the physical distancing that we need. Today is Good Friday. There's no day that emphasizes the importance of sacrifice for a longer-term benefit than Good Friday. So as I join all of you today in remembering the importance of this day, I join you in doing so with a distance of 2 meters apart from each of you. I hope you will do the same. Thank you.
Ladies and gentlemen of the press, good afternoon. So mine will be quite brief because the Honorable Minister of Health and the DG and CDC has already mentioned a lot of the things I was planning to say. First of all, I would like to, on behalf of the PTF, continue to appreciate the patience and understanding of the general public as we continue to work together to protect ourselves and our loved ones. We have noted that some states have started lifting their ban or relaxing their containment protocols. And this is really not the right time to do so, partly because we still have an ongoing pandemic which is global. It is also not the right time to do so because we could end up having a real recrudescence of infections. At this point, I'm appealing to our local community leaders, our religious and traditional leaders, as well as the state authorities to continue to support and encourage the public to maintain those protective measures that are important in getting on top of this infection. There's also a very strong need for state governments to work in harmony and align with the federal government in our effort to deal with this pandemic. This pandemic is not just an Abuja or Lagos issue, it's a national issue. With regards to the Easter celebration, as the DG and CDC said, we would like to remind the public that we're still in lockdown for Lagos, Ogun, and the FCT. The evidence so far from literature shows that the cessation of movement, or otherwise called lockdown, continues to be one of the most effective physical distancing measures when it comes to controlling COVID infection. After all, this is an infection that is invisible. This is an infection that spreads socially. It's a very social virus. It requires close interaction with each other. So if we can maintain that distancing, we might be able to fight it more effectively. In terms of the medical side, again, I would like to ask state governments working through the state task force teams or the state ministries of health to consider setting up accreditation teams that would accredit particularly private facilities, but also public facilities, for the simple reason that it's really important that our frontline healthcare staff know how to use PPE and know how to protect themselves from this infection. We are very keen to expand the availability of intensive care facilities beyond just the public sector. And I'm calling at this point on the private sector, particularly those in Lagos and Abuja, to approach us or to approach their local authorities to get in contact with the accreditation teams that have been formed by the Federal Ministry of Health and the Lagos State Ministry of Health, so that they can accredit themselves and we can start using their facilities in a proper way. Again, I would like to remind both public and private health facilities to please continue to have a heightened awareness of possible cases of COVID-19, and this includes the public as well. If you do notice people having unusual respiratory illnesses or clusters of death related to respiratory tract infection, we definitely will need to know. Thank you very much.
Thank you.
With whether we are doing better with regard to our COVID-19 response. And that's a very important question. It's important because the essence of what we are doing here, what the Presidential Task Force is about, just that. And you can answer it in several ways. If you look at the figures that we have, today we have 288, the other day we had less than that, and so on. You could say we are increasing. we are not doing well. You could say so. But on the other hand, if you compare the figures that come from Nigeria with other countries, you will say, well, we are not that bad off at all. And particularly if you want to extrapolate it with the population and the volume of travelers, you will say, well, we look to be doing well. And then you can also compare with what some organizations modeled. They modeled that by this time Nigeria will really be in very serious trouble because of the way our country is structured, our dense population and so on. That hasn't happened. Now, we have never mentioned that until you ask it now, because we don't want to rest on our oars. We are not out of the woods. The problem can still be very serious, and we still have a long way to go and a lot of hard work to do. So, while on the one hand the figures have increased, and on the other hand, relatively speaking, we do not have the figures that others have, and we are not having as many fatalities as other countries. We know that the situation for our country is extremely important and very, very of great concern, let us say. It must be delicate for us to continue to, not to rest on our oars, but to continue to push further. So the other question is regard to the team from China. The team from China are experts who came here to, first of all, let me say that they are under quarantine. We told them that when you enter our country, you have to be under quarantine. And they said they understood. And we also told them that before they come, and we asked where they will do the quarantine. They said they have a hospital, they have a compound. And we said NCDC will go and inspect that compound, inspect the quarantine before they come. So that one happened. NCD went there to inspect and saw the quarters there where their hospital and their quarantine is. We also asked them that every day NCDC will have access whenever they like to come and inspect. So that is what they are, have agreed to. Now, whether they're treating people, treating Nigerians or not, I doubt, because if you're in quarantine and they understand that they're in quarantine, and I believe they already have arrangements there for themselves, it's not these new strangers you are going to immediately start using for treatment, to treat your people. So I do believe that the NCDC will monitor them and see that they're in quarantine. But our main interest in these people is to see, from a scientific point of view, what actually the processes were that they used in their country, what are the tactics that they applied. Because if you want to know something, you ask somebody who has suffered it before. And those who have suffered it, they have gone through heavy COVID-19 infection, they have dealt with it, and I will tell you that they will admit to you that they made some mistakes, they developed new strategies, and they have various lessons and learnings that they have, which we are saying we want these lessons. We want to know how did they deal with their problem. It's part of our own preparation, our own preparedness to protect our people. If you want to claim that we know everything about COVID-19, that's not true. We don't know everything about it. We read about it in papers. We also read about it in journals. We listen to the WHO. But for those who have actually had a hands-on experience, the public health experts there, if they can help us with information about how they solve their problems, we shall learn a lot from the point of view of the Ministry of Health. We have told them that even though they're in quarantine, if they can join us by video conference to begin to ask questions already so that they don't waste the period. So as from next week, we join by video conference so that we start asking them questions. They are preparing translators to help them to give us the benefit of what they know. So that is the issue of I think that's all about that question. And we have also told them that whatever it is they brought will have to be certified by NAFDAC, whatever medicines they brought. But I must also remind you that what they brought to us are gifts. We didn't pay for it. We didn't pay one dime. They even paid for the transport, for the shipping to come here. So what we say to them, first of all, and they did all of this in spite of shortages that are global. There are global shortages. Not many countries can get everything they want at the moment. So we do appreciate that they brought these things to help us and support us here. And the medicines will be certified by NAFDAC before Nigerians will take those medicines. So I think that answers the question.
That question should go back to you. You're the journalists in the room. I hope you're documenting the response. Our responsibility is to do the response and do it the best way we can. So I really look forward to your stories as you document the very hard work healthcare workers are doing across the country. The second one was on community spread. Yes, we are seeing some early indications on community transmission. And that is why we say that I think yesterday, the last time I presented these figures, about 30% of patients, we haven't quite figured out from whom they got that infection. So that's an early indicator of community spread. But we are working extremely hard right now. That's the purpose of the lockdown, was to enable us to do this work. We can confirm that we know and are following up 91% as at yesterday of all the contacts of all the confirmed cases. So as at yesterday, we had identified and are following up every day 91% of all the contacts of confirmed cases that were confirmed up to the end of yesterday. My friend in Channels asked about the discrepancy in the Bauchi cases. We had previously announced that there were 6 cases, and then we updated this to 4. Ladies and gentlemen of the press, yesterday at 9:30 p.m., we announced publicly that yesterday, I'll read it out verbatim, because we have promised to always be transparent in our communication. Yesterday we erroneously reported 2 new cases in Bauchi. Following further review, we can confirm that these were repeat tests for previously confirmed individuals. We apologize for this error, and we remain committed to ensuring transparent and accurate reporting of test results. This was made public yesterday. That commitment stands. Every new case, every new confirmed case is followed up by testing every 48 to 72 hours. There's no other way to know whether you've cleared the virus. So sometimes when these forms and samples come to the labs, it's not always easy, because sometimes the forms are not complete to say whether this is a new case or a repeat case for a repeat test for an existing case. So in this particular case, there was a mistake. We corrected it. We made it public. I think we did the right thing. In terms of our staff strength, yes, as at yesterday, we had teams deployed to 17 states in Nigeria. And you're right, the colleague that asked the question on whether we will have the capacity to keep doing this. You know, sometimes you plant a tree many years ago and you never know the value it will add. So 11 years ago, a tree was planted in Nigeria. It's called the Nigeria Field Epidemiology and Laboratory Training Program. It's in its 11th year. Every year we admit 50 individuals to train them on a 2-year program on field epidemiology. These are all public servants. They come from the states. They are trained for 2 years with us. They go back to the states. So what we do when we are responding to this, we bring them back into the teams. They already know how we work. They've worked with us for 2 years throughout their training. So really, this is the resource that we're now pulling into the country to support our response as we deploy. So in many of these teams, there might be 1 or 2 NCDC core staff. The rest are around field epi graduates across the country. But no doubt, we're working hard, and we've gotten assurances to increase our staff strength. There's no way that the numbers of individuals we have in NCDC will support us into the future. But that's an intention for the future. Now we have to make the best of what we have. There was a question on Brazil. I really don't know the details of that specific case, so I'll look into it a bit more after this press conference. I think the last question was on fake news. And there was one relating to us directly yesterday, flying around about how we spent 1 billion naira on SMS messages. you know, we keep trying to debunk these messages and keep trying to focus on the work that we're doing. The work that we have to do on behalf of all of us is hard enough on its own. So there's nothing else we can do but to hunker down and focus on that work and really rely on you that see us every day here, feeding back to you, to share some of these stories. Everyone across this room is working literally 18 hours every day. We're not looking for praises. It's just to say we are working very hard to make sure that we can get ahead of this curve. There was no 1 billion naira spent on SMS. In fact, we haven't spent a single naira on SMS messages. Every single SMS you get with NCDC messages have been supported by the private sector, paid for directly by some of the big telcos in Nigeria. And they support this. There wasn't actually any transfer of cash. I actually don't know what they have paid, if they have paid anything. I received the text messages just like you do. So that is just to assure Nigerians that as we carry on this response, the accountability for the resources that we've been given to carry out the response is very important to us. And we've received very clear instructions from Mr. President to make sure that every naira we spend is spent well and can be accounted for in the response. Thank you. Thank you, Rachel. The lessons from the outbreak are not only being documented because this is a new virus. They're being used every day to shape the response. So every day, like I've said severally, we are learning, we're documenting, but more than documentation, we're using it. So that's the purpose of the EOC that we have, where new ideas are brought in, strategies are changed. You would have noticed the case definition has changed a few times. That's because someone is thinking, how do we change this as the outbreak proceeds? So thanks for clarifying.
To have identity cards. So you may recall, I think about a week or so ago, we shared with you the guidelines and protocol for the lockdown. And as part of that, we quoted from Mr. President's speech where he made clear exemptions for services such as financial services and agriculture. I subsequently came back and confirmed a few days later that when we say agriculture, this also includes animal husbandry. Those guidelines and protocols we have shared with the security services for people who are within these occupations. We expect the security services to comply with our guidelines and respect the decision by Mr. President to exempt certain groups from the lockdown. In terms of the banks, the same. We expect them to provide skeletal services. I know we're going into a major public holiday, so that might explain why maybe some of the banks have run out of money, ATM-wise, etc. But we certainly have given them the go-ahead to continue to provide skeletal financial services to the public. This is very essential for our economy. In terms of interaction with the states, just to let you know that we do have a representative of the Nigeria Governors Forum in our secretariat, and we are working with the chair. In fact, just today I had discussions with him as to what to do to bring forward a representative onto the task force. I'm also due to have additional discussions with the chair of the Nigeria Governors Forum, and on a weekly basis we now have a video teleconference with the state commissioners of health. So we are working very closely with them. As I've always said, this is not an epidemic that is confined to Lagos and Abuja. Epidemics do not respect any physical boundaries. In terms of civil society, we continue to welcome the role of civil society in this response. Community engagement is really essential. We know the civil society have a very good reach into the communities. Algon, for instance, has been working with us at the community level. I understand Nestle, one of the private sectors, has been distributing food packs throughout Abuja, which is really welcome. Government cannot do this alone. This is a partnership. We need to work together. We also need to be kind to our neighbors, our friends, and maintain that community spirit that Nigerians are well known for. The issue of palliatives and whether we're monitoring this or not, as the public are aware, the task force is a multi-sectoral arrangement. So we have the Federal Ministry of Humanitarian Affairs, and we also have NEMA. And all these ministries and allied agencies provide reports regularly to the task force. So in terms of monitoring, yes, we are monitoring, and we hope that by the end of our national assignment, we'll be able to provide Nigerians with very clear detail of what was done in terms of the palliatives that have been distributed, etc. What do we need to do to return back to normal? Well, this is an epidemic, so we need to work together to stop new infections and make sure that those that are infected get well and go back home. So any measure that you can do to achieve these two aims will get us back to normal. Thank you.
It is a very, very serious universal issue or matter of life and death. And so it cannot be politicized. And pursuant to Chapter 2, Section 14 of the Constitution of Nigeria, which states the primary purpose of government to ensure security of lives and property. That's why the task force COVID-19 was established by Mr. President. So it involves the lives of 200 million of all of us. And it takes precedence in this case. Now, the question about the pilots were carrying out national assignment because the speech and address by the SGF, who is the chairman of the task force, and the presidential address exempted oil and gas from the lockdown or shutdown in national interest. And these Cabotan helicopter pilots were flying into the military base for national assignment. Of course, I may not be learned, but I'm lettered. And I understand, if any, in this case there is none, the conflict between a federal and a state law, but I will not argue law on this platform. It's unnecessary. As I said, I'm lettered, not learned. So whether His Excellency, the governor of Rivers State, ought to know if the exempted Cabotan flight will be landing in the military base in Port Harcourt, belonging to Nigerian Air Force. He does not need to know. So that is answer number one. Answer number two regarding the pilots. The pilots will soon be released, will be secured, and there will not be any conviction hanging on their necks. And arising from the constitutional provision and the powers of Mr. President and the seriousness of this task force and the danger of COVID-19 and the way we operate civil aviation, including military aviation, that's why I said that the Air Force officer acted ignorantly when the chopper landed on his property, to have called the governor, and also the federal police who made the arrest within the premises of the military and prosecuted also acted ignorantly, and I said they exhibited incompetence. So, and this matter should not be overflogged. Federal government is a very serious matter. It is there for the 200 million people of Nigeria, whether you're from Rivers or Cross Rivers, from Kano or from Kaduna, regardless. Thank you very much.
In 2017, my ministry devoted an entire National Council on Information summit in Jos, Plateau State, to address the issue of fake news. Because from that moment, we knew that fake news poses a real threat, not just to our democracy, but to the very existence of our country. In July 2018, the ministry launched a national campaign against fake news. This campaign took us to many media houses across the country. And we got the buy-in of many media houses. International platforms, social media platforms also supported us. But yet, fake news has refused to die. Now, but you see, you must ask yourself, what are the motives or the purveyors of fake news? And this is where the real problem is. There's a proverb in Yoruba. It says, "Èèyàn méjì pàdánù rọ, tí ẹni tó ń bá ń pa fún, tí ò bá mọ̀, ẹni tó ń pa, ó mọ̀ pé òun mọ̀." Translated roughly, it means two people cannot be victims of falsehood. If the fellow who is hearing it is a victim, the purveyor knows what he's doing. And this is why it's very important for us to interrogate the motives or the purveyors of fake news. And there are many motives. For many of them, the 2019 election is not yet over. And for them is that we must bring down this government, pure and simple. For many of them, it is about attacking the integrity of some individuals, attacking the integrity of programs of government, so that the government will not achieve anything. If you look at the kind of fake news we've witnessed since COVID-19 started, you begin to appreciate what I'm saying better. I'll just give you 3 or 4 examples, and you see where they are going. They said the committee has decided and agreed on a formula to share whatever money is collected. That attack is on every member of the committee. They are attacking the integrity of the committee. So whatever we say, nobody will take seriously. They said, I said 100 billion naira has been given to people of Nigeria, and that there's actually no hunger in the land. It is to incite Nigerians against the government and against the committee. Then they turned to the DG of and the see this, no, I'm talking to the yes, and said he has spent 1 billion naira on text messages. Of course, they know that the DG of the Center for Disease Control is a key person in this war against COVID-19, so let's destroy his integrity. Then they turned again and said, yesterday, a particular cleric said, the Chinese people are here actually to treat Mr. President, who has COVID-19, and also some members of the cabinet. So you see, you might think this is funny. It's not funny, because they know where they know their aim. They want to destroy the committee. They want to destroy the fight against COVID-19. They want to destroy the government. And it's so sad that otherwise intelligent people believe them. Like they say, once there's poverty, the first casualty is integrity. Now, we're also documenting this fake news. We're investigating the websites. We're also investigating the proponents. And I can share this with you that when we traced those websites, we traced them to people who have a pathological hatred to this government. We traced that to people who have hosted their website outside Nigeria, and we're waiting for them. But you see, I want to take the opportunity to sound a clear warning to all humanitarian organizations, to all the human rights fighters, that no government will fold its arms and allow fake news to destroy it. So when we start taking appropriate action, we hope there will be no complaints from any quarters. Thank you very much.
The exact percentage now, but I can assure you that if you aggregate what the federal government is doing, because sometimes we use these percentages and just look at the budget of the federal government, but the federal government is not the only constituent part of Nigeria. State governments are also investing in health and health infrastructure. Local governments are doing the same. I want you to understand the health structure in Nigeria. Primary health system is exclusively the responsibility of the local governments. The secondary health system, that's where the states come in. The federal government has responsibility only for the tertiary. But over the years, there have been abdication of responsibilities. You find federal government even investing in the primary healthcare system. That's why we have an agency. So if you look at the total aggregate of the commitment of government to health, it might not be 15%, but we are near there. Pardon? 4.2. You take the states, add them to the local governments, you add them to the federal. That's what it amounts to. Or you are looking at the federal budget only. Obviously, you look at the total aggregate of the 36 states plus FCT, look at the 774 local governments, their investment. That's the only way you can arrive at a percentage. Don't look at only the federal government investment. The states are investing. They're building general hospitals. We are not building general hospitals. That's their responsibility. But by the nature of our politics, even at the federal level, you find community or constituency projects that are primary health clinics. If you aggregate the number of primary health clinics we have in Nigeria, it's over 10,000. But how many of them are working? So it's a major issue. And that was part of my address yesterday when I spoke to the National Assembly. I said we need to sit back and reconstruct our investment into the healthcare system. But the federal government is doing a lot. Right now, there's a provision of 1% of the, from the Consolidated Revenue Fund, which goes to the Basic Healthcare Provision Fund. 1%. Or whatever goes into the Consolidated Revenue Fund goes to this particular fund. I think it's domiciled either in your ministry or in the primary healthcare agency for distribution to different sectors of our healthcare system. So my answer to that is that we are doing good, but not as good as we ought to. Investment into our healthcare infrastructure must be looked at seriously. It must be looked at seriously. Right now, nobody can go elsewhere to seek medical attention. So probably this is the right moment that we have to be reflective and sit back and begin to address these issues. Nobody ever thought that you couldn't go anywhere to seek for medical attention. 3 months ago, if you were told, you would say, no, it will not happen. But we are all confined here now. Those of us that come from the rural areas are still rugged enough to be on our feet by the grace of God. But we can't take these things for granted. We can't take these things for granted. So much is expected, and I believe that this would help us reflect on how we deploy our resources going forward as a nation to care for the basics that touches the life of the people. About our engagement with the Governors Forum, we have engaged and we continue to engage. The first thing we did was that during the National Economic Council meeting, the last one, I attended. The Minister of Health, the Minister of State, and the DG and the National Coordinator attended, and we had the privilege of briefing them about the activities of this task force. We followed up by teleconference with the governors because of the cessation of movement. We can't move. So we followed up with that. And on a daily basis, I speak to the chairman of the Governors Forum so that we can be on the same page. The DG of the Governors Forum has attended the meeting of the task force and discussed with us. We have even allowed them a representation into the working committee so that they can have up-to-date information on a daily basis as to the activities of the task force. So in terms of engagement, I don't think we are lacking there. But we have to be on the same page. And even in the context of my address today, I did mention that we cannot operate different response. We must operate one national response with the subnationals fitting into the entire national response. Treatment of Nigerians in China. It's a matter of concern, and how I wish the Honorable Minister for Foreign Affairs is here. But I can assure you that he has taken up that matter seriously. The information available with me, to me today, is that he met with the Chinese ambassador yesterday to convey to him our concern about what information is coming out. I saw some of the the clips that are being run on social media. But I must commend the efforts of our officers there, our diplomatic officers in China, because in one of the videos I saw was one of our officers holding Nigerian passports, and he was confronting a Chinese official and asking him whether he had the right to do what he was doing. And I think we are taking steps. And the first step diplomatically was to invite the ambassador to formally lodge that complaint. And I believe that we will receive positive response to that. But I can assure you that it is the responsibility of the Nigerian government to protect our citizens wherever they are on the face of the earth. And we will not renege on that responsibility. We will do everything to assure them and secure their protection until such a time that if they desire to return home, we would also work towards facilitating that for them to come back home. We have been working on that. A lot of discussions are going on. We've asked the Diaspora Commission to network and ensure that they get the details of our people wherever they are through the embassies, so that we can have a comprehensive list of those that are desiring to return and what are the processes we will put in place to ensure that they come back home. Lockdown. Well, the decision for either to extend the lockdown or not is exclusively the responsibility or the decision of the president. Ours is to provide him with background information that would inform that decision. So I cannot speculate on that now. But looking at what is happening in other climes, you will be able to deduce what might likely happen. But I'm not in a position to speculate on that. I believe strongly that the information that is required will be made available to Mr. President, who would look at the holistic picture, because it's not only the information that comes from the Presidential Task Force that would inform his decision. There are other sources of information that comes to his desk as the President of the Federal Republic of Nigeria that would inform a considered decision in this matter. Thank you.
Thank you very much from this pandemic. The message coming out of today is that we must operate one national response across board. Distinguished ladies and gentlemen, and Nigerians watching us from their homes, we thank you for staying with us. We shall be updating you on Monday, 13th of April. There is no holiday. There is no holiday for the PTF and for the members of the press that have been attending to us day and night, making sure that they bring you accurate and authoritative information. I thank you very much. God bless us.